I'll quickly look at how to access for symmetry of body structures in patients. Now, let me just give you guys a small illustration. Now, once you say symmetry, it's just very simple. You are looking at something on the left side, then you're looking at the same thing on the right side, and you're trying to look at if they are the same, or at least they are closely the same. Because why? You could be using this body part on the right, and it could be obvious that it will develop more than the one on the left, but at least the development will not be too far. Do you understand? So there's a way you access structures on the left and the right and try to see if a disease condition has actually affected, any one of them, or a medical condition, right? So let's look at it. So it's just a fundamental part of physical examination, and it helps clinicians to now dictate abnormalities. Let's see if an abnormality is occurring on the left only and leaving the right, or on the right and leaving the left, or on both sides. So it can help you access for things like is there a deformity, is there muscle wasting, is there swelling, is there asymmetrical growth. So what are the key areas to access? You look at the face, the head and the face. You compare both sides. That's the face. Now you're dividing like this, the right side, the left side. So you can dictate for conditions like all those facial droop, asymmetry in the eyes, ears, nose, mouth, swellings or masses. On the neck, you're looking at all those symmetry for sternocleidomastoid muscles, tracheal alignment, okay, thyroid enlargement, okay. Then on the chest and shoulders, you are trying to look at if the shoulder is the same, if the chest is the same. So you're also trying to look at all those deformities, pectus excavatum, scoliosis, a lot of them. Okay. In the upper limb, you can now compare the right hand and the left hand to look at the muscle bulk. Is the muscle bulk going away, or is it more? Okay. Arm length and alignment, hand and finger deformities, you're looking at all of that. Okay, so you can see asymmetry just simply means one side is higher than one side. That's based on height. Then based on muscle mass too, you're trying to look at one side has too much muscle, the other one appears wasted. So on the lower limb too, you're trying to look at the leg length. So the length of the leg, is this the same? Also trying to look at knee alignment. You're trying to look at muscle wasting, trying to look at foot deformities. In the back and spine, you are looking at if the person has scoliosis. That's where you now do all those Adam forward bending tests, kyphosis or lordosis. In the abdomen, you are looking at the contour and the symmetry. You're looking at the localized swelling or hernia.